Hey, I'm Kirsten, and I'm going to do my video on pyromania. And pyromania is the uncontrollable impulse to start fires, and it's very uncommon. It's a very uncommon disorder, and it's hard for psychiatrists to diagnose somebody with pyromania simply because there's so many different just possibilities of why they could be setting the fires, and there's certain rules they have to go by. It's very difficult. The DSM-4 says that the individual must set the fire deliberately and have a reason, and they have to set them multiple fires on multiple occasions. So you can't just set one fire and be a pyromaniac, and you can't just set a bunch in one day and be considered a pyromaniac. You must be tense or exhibit emotional behaviors such as facial expressions, excitement, like your voice changes before you set the fire. You must be curious or fascinated or just obsessed with fires, and also the aftermath of fires, what the fire causes to people. You must experience pleasure or tension, relief or gratification when you set the fire, and sometimes just maybe not while the fire, but afterwards, knowing that you accomplished that. You can't have any motivation for setting the fire. If you get financial gain from it, you're not considered a pyromaniac. You can't do it just to express an idea, like when people used to burn books. That wouldn't be anything that would make you considered to be a pyromaniac. It can't be any kind of revenge, just setting someone's house on fire because you're mad at them. It can't be out of anger at all. It can't be because you're trying to hide, like fake your own murder, then you wouldn't be considered a pyromaniac. It can't be to improve your circumstances, like to get insurance money and be able to move out of your house. You can't be drinking or under the influence of drugs when you set the fire to be considered a pyromaniac. If you do have another kind of disorder where you are delusional or you have hallucinations and you're responding to them by setting a fire, that would not allow you to be considered a pyromaniac. If you have dementia or mental retardation or anything like that, or you're addicted to a drug, then you can't be considered a pyromaniac. So for a psychiatrist to be able to diagnose someone as a pyromaniac, they must know that the individual has set multiple fires on different occasions, different time periods over usually years. They have to know that the person is tense or excited around fires, and that their tension goes away after the fire. They must know that the person was not intoxicated, or they had no criminal motivation at all when they set the fire. One big problem is that we just consider arsonists, serial arsonists, to be pyromaniacs, and that's not true. Most of them aren't. Usually about 1 to 4% of arsons are pyromaniacs. Pyromania is generally classified as an impulse disorder, impulse control disorder, and it doesn't just go away. The person does need to have treatment. There's not very much known about what kind of treatment. Some people will go to counseling, and some medicines can be prescribed. It seems to affect the serotonin in the person's brain. There was one psychiatrist, John Grant, who claimed that he had worked with a pyromaniac patient, and he found that his left interior region of his frontal portion of his brain had a low blood flow, And over 12 months, he would go through 3-week behavioral therapy sessions, and he was given a drug called topiramate that is usually used for seizures. And they claimed that the pyromaniac's impulses to set fires decreased dramatically. There's really a debate over whether pyromania is a mental disease or illness, because there's not very much research that has been done. There have been claims lately that there could be a biological cause for pyromania and a possible pharmacological treatment, but it's too early to tell until we have more information about this disease. A lot of people just believe that they are a pyromaniac because they're fascinated with fires, but they would never actually go and set a fire, or they have criminal intent. And there's many, there was a study done of about 600 serial arsonists, but many of them had criminal reasons, or they were trying to hide, or they simply were intoxicated when they committed the crimes. So therefore none of them were able to be considered a pyromaniac. There's about 12 out of 600 who are actually true pyromaniacs. So really, there's not much known about it. It is considered to be an impulse disorder, so it's related to kleptomania and pathological gambling, which also there's not much known about those. It can be associated with a mood disorder too. Many people with pyromania also have a mood disorder, and since the serotonin is affected, there needs to be more looked at in the individual's brain also.